So this is the basic RES-Q-VAC setup. It basically comes with 4 pieces and then the catheter. You can see everything comes together pretty easily. And this is usually the part that we remove at the end of the day and soak in hot water, hot soapy water to clean daily. And that's the basic setup before the catheter is on. You can always test it to make sure the suction coming out, which you can feel with your finger. And then what we do is, before we start, a little bit of Purell. And then what I like to do is I usually end up cutting or tearing a section of the catheter to try to keep it as sterile as possible. And then only having just the tip come out. And then placing it inside the RES-Q-VAC. And the important thing, in families that use this or are used to using suction devices, especially with children with tracheostomies, there is a certain depth that you need to go. The catheters that come with the RES-Q-VAC aren't marked. Some of the hospital-grade catheters do have markings in centimeters, so you know how far down to go. And parents that have a child with a tracheostomy will know what depth to go. But it is difficult to know how far to go with the RES-Q-VAC because you definitely don't want to go too far because you'll cause irritation and the child will cough. What we do is we take it out of the bag. We haven't on this one yet, but what we have marked is that we know for Miles, for his size trach, is that we go down 7 centimeters. So what we end up doing is we mark out from the edge out 7 centimeters, and then with a Sharpie, just make a nick there, place a piece of tape over it so it never gets washed off. And then what we do is each time before we suction, we will just come up to our mark without touching the device and know, okay, we're at 7 centimeters. Right now I'm going to somewhat blindly do this, but it's roughly about 7 centimeters. And again, you want to make sure that it's not too long. If you're going to err anyway, it's probably better to be too short, because again, you don't want to cause any irritation. So again, keeping the tip free from touching anything else, we come over to Miles, our faithful assistant, take off his trach. Again, we measure, and we'll go into his trach, suction on the way out, 1 pass, go back in again, down to our mark, suction, and that's it. And again, very, very simple to use, easy to clean, and I would say more than enough suctioning power for his everyday secretions. If they are a little bit thicker, we sometimes do a saline bullet first and then suction afterwards.